Dr. David Albert at the Digital Health Summit at CES 2019. And today I'm joined by Nandini Ramani from Outcome Health. Nandini, welcome, and tell me, what does Outcome Health do?
Outcome Health is a digital health provider. We provide content at the point of care, which is doctors' offices. And I think it's so important to have authenticated content at that moment of care when the interaction between the patient and the provider happens. And we provide content in the exam rooms, in the waiting rooms, in infusion rooms where you have extended therapy. That's what we do.
So tell me, you say Outcome Health. How do you differentiate yourself? I'm a physician, my wife's a physician, my oldest son's a physician. My wife's a rheumatologist, she does infusion, so I have a lot of exposure. How do you differentiate yourself from other people providing that same type of educational material?
So I think the biggest difference is we are by far the largest digital provider in doctors' offices. And you still see in this industry, and you know this, generations of doctors, we still have brochures and health panels. These are all paper, which is hard to keep updated, it's hard to measure, it's hard to understand it. So I think the rest of the verticals have all shifted toward digital, and that's what we are doing. We're bringing devices that we can then digitally update content. You can picture, when you go in a doctor's office, you know this, you still have 3D models that are physical in the doctor's office. We now have digital wall boards which have models where you can zoom in, you can circle, annotate, so it's a lot more informative for the patient.
And more interactive.
More interactive, and it also lets you navigate and meander rather than just the static things that you see on the table.
Certainly. Now, from your perspective, company's been around how many years?
Like coming up on 12 years, I think.
Yeah. So, I'm certainly aware of it and seen some of the placements that you have. Where do you see this evolving?
That's an interesting question. So I think like with telemedicine and other avenues of where health and wellness is going, today we're in the point of care, and I don't think anything is going to completely disintermediate that point of care, because you're always going to need to physically go see the doctor for various reasons. So we will continue to be there, and then there's opportunities there to integrate within the EMR systems, get more curated content that's personalized, customized to the patient. But in addition, I think there's going to be the evolution of point of care into moment of care, which is, with telemedicine and other remote ways of accessing the patient. And we want to be part of that journey as well with mobile applications and other means of having a to-go model for the patient.
Well, certainly, the doctor's office is not the only venue, whether it's a clinic in a drugstore, or whether it's a hospital room, or whether it's the home. So do you see Outcome Health participating across the spectrum of points of care?
Yes, absolutely. However, I would like to underscore that at Outcome, I personally believe, and that's what our company believes, we're not in this alone. This isn't about Outcome Health. This is about the point of care industry collaborating, consolidating, moving together to achieve what we all want, which is a better outcome for the patients. And so, absolutely, we want a journey wherever that industry takes us to the points of care.
And we certainly want better educated patients. So here you are at the Consumer Electronics Show. Is there anything you'd like to say that you've picked up from here? Clearly a lot of digital technology.
I think it's fascinating for me. On the one hand, you have so many cutting edge technologies, but the adoption rate is still really low and not enough people. So on the one end of the spectrum, you do have where you have web-based diabetes care and all kinds of, I'm learning every day. But the adoption rate is still like 4%, 3%, so we don't have the mass adoption hasn't happened yet, and I'm hoping we can be a small part of accelerating that growth.
Well, excellent. Well, thank you. Nandini Ramani from Outcome Health. This has been Dr. David Albert at the Digital Health Summit at CES 2019, hosted by Living in Digital Times. Thank you.
Thank you.